everyone. Welcome to our virtual class. By the way, I'm Jamalia Enero and I'm your MAPI teacher this morning. Our topic this morning is all about basic of first aid. But before that, this is our objective. Objectives: A. Explain the meaning and importance of first aid. B. Develop the sense of responsibility to help others through the knowledge and application of first aid. First aid is an immediate and temporary care given to a person who suddenly gets ill or injured. It includes self-help and home care if medical assistance is not available or delayed. It can mean the difference between life and death in extreme cases. However, we must know the limits of the first aid we can give because improper first aid can actually do more harm than good in some instances. Anyone who gives first aid is a first aider. Roles of first aid. Number one, it is a bridge that fills the gap between the victim and the physician. It is not intended to compete with or to take the place of the service of the physician. Number two, it ends when the services of the physician begin. Characteristics of a good first aider. Gentle, does not cause pain and panic. Observant, notice all signs. Resourceful, makes the best use of things at hand. Tactful, does not frighten the victims. Sympathetic, comforts and reassures the victim. Principles of first aid. Dose and giving first aid. Do stay calm. Do reassure and comfort the victim. Do check for a medical bracelet indicating a condition such as epilepsy or diabetes. Do loosen any tight clothing. Do keep the victim covered to reduce shock. Don'ts in giving first aid. Don't give food and drink to an unconscious person. Don't move on an injured person unless you need to place him here in the recovery position. Vital signs are measures of various psychological statistics taken in order to assess the most basic body functions. The acts of taking vital signs normally entails pulse rate or heart rate, blood pressure, and respiratory rate. Before airway breathing and circulation or ABC are mnemonics for essential steps used by both medical professionals and lay persons such as first aiders when dealing with the patient. In 2010, the association is rearranged the Pulmonary or CPR and Heart Association Cardiopulmonary and Emergency Cardio published in circulation the American. For more than 40 years, training has emphasized of CPR people to open a victim's putting their head back and breathing in and only then, said Michael. MD, co-author of the guidelines and chairman of the American Heart Association's Emergency Cardiovascular Care or ECC committee, this approach was causing significant delays in starting chest compressions, which are essential for keeping oxygen-rich blood circulation through the body. Changing the sequence from EBC to CEB for adults and children allows all rescuers to begin chest compressions right away. Difference between signs and symptoms. Signs are details discovered by applying your senses, sight, touch, hearing, and smell during the course of the examination. Example, bleeding, swelling, deformities. Symptoms are sensations that the victims feels or experience and may be able to describe. Example, nausea, vomiting, heat, impaired sensations. Two ways to conduct physical examination when giving first aid. Number one, primary survey. Primary survey of the victim is used when the victim is unconscious and to find a check for consciousness. Ask the victim, hey, are you okay? While carefully shaking the victim's shoulder. And immediately treat life-threatening condition. When there is no response, not even mumbles or groans, the victim is open the airway, unconscious and in need of immediate medical help. The victim's unconsciousness may be due to an obstruction in his/her airway. It may also be caused by a narrow airway, making breathing impossible. Find out if there is loss of muscular control in the throat area, which allow the tongue to slip back and block the throat. Lift the chin and tilt the head of the victim. If the victim is an adult, this way you will be able to lift the tongue from the back of the throat, leaving the airway clear. Check for breathing. Put your face near the victim's mouth and look, listen, and feel for breathing. You should observe for chest movement, sound of breathing, or feel of breath on your cheek. Check for circulation. Locate pulse using your middle and index finger. Pulse indicates blood circulation, which is essential for the heart and brain to function. Poor blood circulation may be reflected on the pale color of the skin. This is fatal. To revive circulation, perform CPR immediately. Second sorbet. Secondary sorbet is used when the victim is conscious or has revived. It aims to detect everything about the patients. Taking sample pain in the mnemonic in order to perform the steps more easily. S. Symptoms that chef complain of the patient. A. Allergy. Find out if the victim is allergic to anything. Medication. What are the medicines she is currently taking? Previous illness that may be related to the problem. Last meal only for those subject for operation. Events prior to what happened. Period of pain. How long? What started it? Area. Where is the pain coming from? Intensity. N. Nullify what stopped it. B. Checking for vital signs. A pulse rate. Steps in checking the pulse. Use your fingertips in getting the pulse. Follow the following procedure. Place the fingertip over an artery where it either crosses a bone or lies close to the skin. Feel the pulsations as the pressure wave of blood causes the vessel wall to expand. That is the pulse or brachial. The pulse rate may be taken in different points in the body like carotid, wrist, temporal, subclavian, axillary, femoral. No in getting pulse rate. Never use your thumb. It has its own pulse. Do not palpate both the carotid arteries at the same time. Do not take the pulse when the victim is in sitting position. Pulsations disappear as the victim is elevated to a sitting position. Never put too much pressure or massage the carotid. You may disturb the heart's electrical conduction system. Normal pulse rate 60 to 70 men, 70 to 80 women, 80 to 90 children over 7 years old, 80 to 120 children over 1 to 7 years old, 110 to 130 infants. B. Temperature. Guidelines in checking temperature. It is being important to monitor temperature in the case of stroke and high fever. Body temperature is measured by using a thermometer within the rectum or rectal, oral or mouth, axillary or armpit. Respiration. Guidelines in checking respiration. Count the number of breaths per minute. A whistle sound or wheeze and difficulty in breathing may mean an asthma attack. A gurgling or snoring noise and difficulty in breathing may mean that the tongue, mucus, or something else is stuck in the throat and does not let. Between 12 to 20 breaths per minute are normal for adults and older children enough. Air to get through. 40 beats per minute are normal for babies. Head to toe examination. Head and neck. Are there any lacerations or contusions in the area? Is there a presence of blood in the victim's hair? If yes, immediately find out where it is coming from. Is there any fluid in the victim's nose and ears? If so, the victim has a skull fracture. Number 2, eyes. Pay close attention to the pupils. Pupil appearance and assessment. Dilated pupil. State of shock. Very small pupils. Poison or use of prohibited drugs. Different size. Head injury that requires immediate attention. Small and bright. Pupils are reactive. No reaction. Death. Chest check for cuts, bruises, penetrations, and other impairments. If the victim feels pain while you apply pressure onto his or her chest, there could be a rib fracture. Abdomen. Does the victim's abdomen hurt? Where is the pain coming from? Back. Is his or her abdomen tender? Did you feel any lumps? If yes, get immediate medical assistance. Is there movement in the victim's lower extremities? Is there sensation in these parts? If the answer is yes, do not move the victims, immobilize him or her. 10 things to do in case of emergency. Shout for help. Survey the scenes and assess the situation. Determine if the accident warrant a visit to the nearest hospital or if simple cleansing and band-aid will do. If you are certified in CPR and the victim needs it, begin CPR right away. Stop the bleeding if there is any. Treat any symptoms of shock. Look for the medical alert tag in every victim. Seek trained medical assistance. Never give anything by mouth to an unconscious victim. Wait for medical professionals to arrive. So, any clarifications, suggestions about our topic this morning? So, if none, thank you so much for listening. And don't forget to subscribe our YouTube channel, www.gaitf.com. And don't forget to open your LCMS. Thank you.